Hey guys, it's Mel. I am really excited today because I'm going to do a little video on Botox, all the different places that you can do Botox on your face. It helps to decrease dynamic movement in the face that starts to make wrinkles happen. So most people know about Botoxable areas being kind of the frowning lines, your crow's feet, different areas. Those are the only two FDA approved areas, but there's a ton of different places you can do Botox. So I'm going to do a little demonstration by making a little mark where we want the Botox and where we put the Botox to see the difference, and all the different places on your face you can do Botox, because it's pretty incredible. All right, so I'm going to take the pink crayon and I'm going to draw the lines that people see. Then I'm going to take a white crayon and I'm going to draw where we can put Botox to help to treat those areas. Botox is the cornerstone of our industry. It is the thing that the majority of people are more comfortable with. They kind of know what it can do, but not necessarily all of the different places that you can put it. So the key with Botox is that it helps to decrease dynamic movement. So when we move our face around, it starts to eat up collagen. So you can put even just little dabs of Botox that help to decrease the movement in some of those muscles that helps to let your body produce its collagen. For example, the number one area that most people see is that little line right there. And that's called your glabellar muscle. It's either the 1s or the 11s, or sometimes it's the 111s. Okay, the other one that it affects is kind of your procerus muscle. Call that the bunny line, the squinty line. So that is the number one most Botoxable area. So we do Botox through the middle here, we come a little bit lower, and then we actually go into these glabellar muscles, because if you see, when I try and frown, it's these muscles that come together that cause those lines there. Now I got Botox there, so you can't really see it doing it that much. Botox kind of goes through the middle here, but into the muscles that cause the lines through the middle. Okay, so a lot of people say, well, you missed that spot where I have the line, but it actually goes into the muscle that's causing the line. Make sense? The second place that's FDA approved for Botox is the crow's feet. So the lines that come out the side, out through this way here, and down the cheek even a little bit. Okay, when you smile, and that contraction happens and it causes these little lines, the places that you can relax the muscle that helps to stop the contraction, so we can Botox that. I look like a kitty cat. Okay, so you do Botox through here, through here, through here. You can get nice and close to the corner of the eye, out through here. Same thing on this side, down a little bit lower, under here, and here. The thing with Botox is that you can't really do it underneath the eye, okay? It decreases the contractility of a muscle, so we want those muscles to work, right? So you can't go right underneath your eye with it. So sometimes when there's textural issues or under eye bags, that's either more resolved with either a filler or with skincare. Sometimes though, if things have progressed a certain way, we will also recommend surgical options. The third place that's the most common is right up here. I look so pretty. So forehead lines, when we start to get the horizontal lines that come across here, that muscle, those are called your frontalis muscles. Okay, so when you raise up your eyebrows and it starts to create those lines, you can do Botox up there to stop the contraction that will help to decrease the contractility of your forehead so that it'll soften out those lines. The thing with the forehead, that is where sometimes people will feel a little bit frozen, okay? Because you can't raise up your eyebrows as much as you used to. So oftentimes I will either not do the forehead or I'll do a super duper light dose in the forehead, because you need that. It's like a give and take. Because if this is completely relaxed, like on me, if I totally dose my forehead, I can't raise up my eyebrows and I look like this. Not what you want. And completely frozen look, oftentimes that's because you've overdosed the forehead. One of the other fun things the Botox can do is it can actually raise your brow a little bit. So not that you necessarily get a line here, but when these muscles contract, the muscle that runs around your eye is a circle. Okay, so when it contracts, it comes down. So when you put Botox in there, it can help to lift it up a little bit. That's called a lateral lift. So oftentimes we'll put Botox, my white pencil, right out here, and it helps to just bring up the corner of the brow just a little bit. Okay, it just puts that muscle to its most relaxed state. Those are the three areas that most people are most comfortable with injecting Botox. Everybody kind of knew yep, that's where everybody gets Botox. You can do it in so many more places though. So this is the cool part. This is where we get even fancier. You can actually do Botox in your lips, which sounds a little crazy. Some people also think that filler is Botox. So when they say she has a ton of Botox in her lips, she looks like this, that's filler. It's not Botox. So when you get the little lines here, oh yeah. Okay, so that pursing contraction is what causes those little lines, okay? We used to call them smoker's lines. Nobody smokes anymore, but now they're straw lines. Stop using a straw, because that contraction is what causes those little lines to happen. So sometimes I'll do Botox here and people go, oh my God, my favorite water bottle feels so weird to drink out of now. I'm like, throw that bad boy out, because that is what's causing those little lip lines to happen, okay? So out through here, right in through here. There's actually 3 places within this 1 little centimeter that you can do Botox that do different things. Right in the border of the lip area here, right here, you do something called a little lip flip, which just relaxes that muscle a little bit to make it pop out just a little, adding a tiny little bit of volume to your lip without adding any actual filler. It doesn't work for everybody. It's more for people who kind of repeatedly contract, or if this is their concentration face. You can put a little Botox there and it helps to relax just a little bit so you can see it a little bit more. The upper lip lines, that's the one right above it. And then there's actually another shot you can do up here. Why would you do Botox there? For a gummy smile. When people smile and all you see is gums, if you do Botox here, you're relaxing that levator muscle that's a little hyperreactive, and it'll drop the lip. Okay, so you drop that lip and it helps it so when you smile, you just see your teeth and your lips. Okay? Another place that people Botox for a medical reason is something called TMJ. I don't know if you can hear that. It's when you have a click in your jaw, and it's just something you can help to relax. It's also called your masseter muscle. So there is an aesthetic benefit for doing this too. If somebody has a really square jaw, this is really popular in Asian cultures, you can actually do Botox back through here. So it's not that you have wrinkles happening back here, but to help to minimize this muscle here. So if you get a little bit squared off and you want to bring this muscle down a little bit, if you repeatedly treat this muscle with Botox, it'll do something called atrophy, that it will actually lose some of its volume, okay? So we can treat this muscle here. Not only does that help with TMJ, but it does help with atrophy, so it changes the face shape a little bit too, okay? So we put Botox back through here. We have them clench that muscle. So this is all about the muscles in your face. Okay, so Botox back here. Perfect. Okay, so one of the places that I love to get Botox on myself is for my frowning lines down here, okay? Oftentimes this is addressed with a filler if you really have volume loss and you have a fold here, but it's all about the contractions that our face makes that sometimes can make either lines or wrinkles or a dissatisfied face. So I actually make this face kind of often. Okay, where it just pulls down through here, and if you look closely, when you do that, it causes little textural lines to happen too. So if you look in the mirror and you see all these little textural issues, Botox there is actually even better than doing filler there, because you don't necessarily want to add a lot of volume to your lower face. You want the volume to stay higher through your cheeks, and this to just be nice and smooth. You can, for these little textural issues down here, wrinklies, you can do Botox through the corners, right in the corner of the mouth, and then down here we call this the DAO shot, okay? And it stops that pulling down of the sides, okay? So it just relaxes the corner of the mouth to help to bring that up just a little bit. One of the other places you can do Botox is actually in the tip of your chin. And people say, well, why would you do that? And it's for kind of that cottage cheesy chin, when you're just having more textural issues down through here and it's not necessarily volume loss. Sometimes we'll add filler to the base of the chin that helps to pull it out a little bit, and that can help to smooth things as well. But even just a little bit of Botox can help with the little dimply contractions. So the little tink, 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 sorry, yeah, these are my lines. So my little cottage cheesy chin. You can do Botox. And help to treat and smooth that a little bit. Back up to an original place, one of the other places that people start to get a little bit of wrinkling is actually on the nose. These I call the bunny lines or the skinky lines. That come this way. I call them the stinky cheese face. If everything is nice and smooth and relaxed up here and you start to get little lines on the nose, you can actually do Botox on the nose itself. So you just go right through the corners, tink, tink, on the nose. You can't do Botox under here, but you can do on the nose, and it helps to relax that just a little bit. So the last place that I'm going to talk about doing Botox is actually in the neck. It's a pretty popular place that people hear about nowadays, that people do it more and more, but it's a specific thing that it helps to treat. It's called your platysmal bands. And they're kind of the long, skinny bands that people will get as they age, this little band thing through here will split, and you'll see a little string come here and here. If you think of pretentious, gracious, my girl, if you do that in the mirror and you see these little things come up here, you can do Botox through those lines as well, where they start to appear right through the middle. And the Botox in those areas just helps to relax that muscle. We just go right up it and we treat the sides of it on both sides, right into that platysmal band. And it just helps to atrophy that muscle, similarly to this injection, where it softens it enough that it just makes those bands recede into the neck a little bit. It doesn't really help with crepey skin. It doesn't tighten things up. It doesn't take away the textural issues. It just helps those bands. Botox in the neck is something that people talk about a lot, but it's a very specific thing that it treats. All right, so that's it. This is a simple Botox treatment. Just kidding. A lot of people come in for just one of these issues. We don't treat every issue on every person because it's really specific to you. And the really cool thing that's happened with Botox in my time frame in the industry is when I very first started, people were like, I want to be frozen. I want no movement. I don't want to move. I just want it to be... And so we were loading people up. There's a lot of times I've lightened people's doses by almost half, even by a third, like down to a third, because they want movement in their face. You want to be able to say, what? You want to be able to raise your eyebrows. You want, when you smile, to have some lines. So the nice thing about Botox is we can tailor it and actually dose it to be appropriate for your muscles without making you feel like you're completely frozen or look like a deer in the headlights. Like me right now. Botox normally lasts people around 3 to 4 months. Everybody's a little bit different. The FDA says it's 2 to 4 months. If you are a marathon runner or a professional athlete, yes, it will burn through you faster. If you, though, have a girlfriend that says, well, my Botox lasts me 6 months, you should go to my girl. That's about her muscles. It just means that she's been doing Botox long enough that she actually has trained her muscles to stay relaxed. So I have a lot of patients that their Botox lasts them 5, 6 months. It's just they've been doing it for a long time. The first time you do Botox, you should anticipate it's going to last about 3 months. Everybody's a little bit different though. But again, it's kind of up to your body. It's up to your metabolism. So that's it. That's my spiel about Botox. There's a ton of different places you can do it that people don't even realize, and it doesn't need to be a lot of units. Some of these locations, I only use like 6 units. So when it's $10 a unit, that's 60 bucks. But it just depends on how your muscles read, where you really need them, and to go to somebody who is a trained professional. I'm clearly professional. So that's it. That's all the different things that Botox can do. So if you've never had Botox before, or if you're scared about it, I hope that you can rewatch this video and maybe learn a little bit more about it. If you have any questions, please comment below. If you liked the video, please like the video. And if you want to share it, you're more than welcome to. Thanks for watching my video.